Dr. Mike, the YouTuber, recently posted a video on how his Husky lost a leg because of a sarcoma in a right front paw and some questionable decision making by the veterinary team. So me, as a veterinarian from South Africa, decided to react towards this video just to give you guys some insight as to how one would usually approach a case like this and to show you what you need to ask your veterinarian in the event that you need to make important life decisions for your pet, as Dr. Mike had to do with his dog Roxy.
So to set up the story, Roxy now lives with my dad, so he takes care of her vet stuff, takes her in for checkups, and Roxy had sort of a bump growing on her right arm. And this bump was there for several years. It may have grown slightly over the course of those years, but this bump never bothered her, so I wasn't too concerned about it. But my dad said, you know what, I'm gonna point it out to the vet on the upcoming visit, which I thought was a very good idea.
Now, it is quite common to start seeing lumps and bumps on older dogs, and yes, it can sometimes be a bit difficult for the pet owner to know whether or not this will actually be a problem or not. Usually, if the lump grows very fast, like it doubles in size within a month's time, or if it becomes ulcerative and starts to bother the dog, then this should usually warrant alarm. But it is always better to rather take your dog into the vet to have it properly checked out so that you don't waste valuable time in case this is something serious.
So when they went to go get this bump checked out and an overall physical, they said, you know, for 12 years old, this dog is doing very well.
Wow. The average life expectancy for Huskies is between 11 and 13 years. So for a 12-year-old, Roxy looks really great. Now, it is really important that even though the main reason why the dog was taken to the vet was to check out the lump, that the vet performed a proper physical examination by looking at the dog's overall condition. An aggressive tumor, for example, will likely first spread to the regional lymph nodes, which sits under the jaw, in front of the shoulders, in the groin and at the back of the stifles, and later it might spread to internal organs like the spleen, liver and heart. And just by physically feeling the size of all the lymph nodes and palpating the abdomen properly, we can often actually feel the enlarged lymph nodes as well as irregular growths on the internal organs, which would usually raise alarm and warrant further diagnostics.
But they said we want to take a sample of the bump on her leg and send it for cytology.
So there are basically two main ways in which we can determine what type of growth we are dealing with and whether or not we should consider removing it. The first and easiest method is called cytology, which Dr. Mike pointed out, which is where we perform a fine needle aspirate, where we stick a small needle into the bump and then try to aspirate cells from inside the lump. Most vets will usually then look at the cells under a microscope themselves, but you can also send it away to the lab for the clinical pathologist to examine. Cytology is a great screening tool, and most of the time it should be able to tell us which cells are present and whether or not they look malignant. But the best way to know for sure is to perform a biopsy, where we either cut out a small piece of the growth or we remove the entire growth and then send this to the lab for histopathology in order to properly diagnose and grade the growth.
And then when the vet ended up calling me back, they said that, you know, unfortunately, the cytology came back and it looks like this is a cancerous bump. They called it a sarcoma, which means that it's a soft tissue cancer. And they recommended bringing the dog back in for a consultation with the surgeon.
So you basically get three different classes of tumors: round cell tumors, epithelial cell tumors, and spindle cell tumors. A sarcoma, which is what Roxy's cytology diagnosed, is a soft tissue or spindle cell tumor that can be found anywhere around the body, usually underneath the skin in the connective tissue, muscle and nervous tissue. Now, if the sarcoma causes physical pain such as discomfort when walking, or it becomes ulcerative, or it is diagnosed as being a high-grade malignant tumor, then the treatment of choice is surgery, which is what the vet seemed to have suggested here.
I know how surgery is difficult on humans, and I can only imagine how difficult it is on dogs who need activity in order to stay fit, in order to stay mentally well, especially dogs like Roxy. She's so active, she's a Husky, she has so much energy in her.
Well, this is a good point that Dr. Mike makes. One of the most important factors influencing a surgery success is the post-op care. With humans, you can tell them, listen, you need to sit still for a moment in order to allow your wound to heal. But with animals, on the other hand, they don't speak our language, so it is much more difficult to keep them still, which often leads to post-op complications.
So I told my dad a list of questions that I wanted him to ask the surgeon. And those questions are questions that you should always ask before going in for a procedure. A, is this type of cancer that Roxy has dangerous in that is it likely to spread? Is it likely to cause problems elsewhere in her body?
Yes, so the tricky part of tumors, especially for someone's Roxy's age, is to try and determine whether or not surgical removal really is the best option. With histopathology, the tumor can be graded from stage 0, which is the early stage, to stage 4, which is the late stage. If the tumor is stage 4, it is usually classified as highly malignant with a chance of metastasis, meaning it is likely to spread to other regions of the body, especially the lymph nodes, spleen, liver, heart and lungs, depending on the type of tumor. In these cases, it is highly recommended to remove the tumor while it is still in its early stages, because once it spreads to other regions, it will be too late, as removing the tumor itself will not contain the tumor anymore, and then you will need to consider things like radiation and chemotherapy. In these cases, your vet may recommend additional diagnostic tests like performing cytology from the regional lymph nodes, as well as taking x-rays of the chest and performing abdominal ultrasounds to see if he can find any evidence of cancerous spread. Another thing to take into consideration is the safety of performing the actual surgery. Older dogs poses a higher risk for general anesthesia, and it is therefore recommended to perform pre-anesthetic blood tests to see if the organs, especially the kidneys and the liver, are still functioning well. If it is discovered that the dog also has concurrent kidney or heart disease, she might not even survive the operation. So then surgery might actually not be the best option.
What's the 5-year survival rate? What impact will this have on her life as a 12-year-old dog? Is it worth for a 12-year-old Husky to go for a surgery on her leg to remove a tumor that so far has yet to cause a problem?
These are all valid questions to ask. Roxy is an old dog and sadly probably only have another year or two before her quality of life starts to deteriorate due to old age. So the question to ask is, will this tumor, if left untreated, shorten her already short life expectancy to such an extent that it is worth risking a surgical operation on an old dog, as well as the potential post-op complications?
And the next day, he sends me a picture of Roxy wearing a cast, healing up in the sun in the backyard.
Okay, so it seems like they've gone ahead and removed the tumor. Now, I'm not exactly sure where this tumor was or how big it was, but the challenge with tumors on the legs or paws is that there is very little loose skin to close the gap where the tumor was cut out. And sarcomas are notorious for having tentacle-like growths underneath the skin, so the bump that you see on the outside is kind of like the tip of an iceberg, with the actual size of the tumor being much bigger underneath. Now, in order to prevent the tumor from returning, the surgeon needs to achieve what we call clean margins, which is when you remove enough skin and soft tissue around the bump so that all of the macro and microscopic cells are cut out. This makes removing a tumor in this area especially difficult, and often if we cannot get the remaining skin close enough together again, and if a skin graft is not an option, we will pull it as close as possible using tension relieving suture techniques, and then just bandage the leg in order to protect the wound from getting infected from the outside.
She had to go in for multiple wound checks to get her wound examined. There were sutures in place, staples in place, and they needed to constantly check this. So she was on antibiotics, they were doing these checks.
Now, it is really important for these bandages to be regularly removed at least once every second day, so that the wound can be properly examined to make sure that the skin is taking and that granulation tissue starts to form in the hole where the bump was cut out, as this will all indicate that the wound is healing and that the treatment is working.
I noticed that the bandage was on really tight And then like a week goes by. I need you to come home after the hospital and look at Roxy's leg. I don't think it's good. Probably we should go get it checked out at the vet.
So the biggest risk with bandages is that if they get wet, they will start to shrink, and this can cause severe problems for the wound, as it may end up cutting off the blood supply to the wound area, which means it will not receive all of the necessary oxygen and nutrients in order to heal properly, which may cause the cells in that area to die off and become necrotic. So if you notice that your dog's bandage looks too tight, then take them back to the vet immediately so that it can be removed and reapplied.
So when I came by, I'm looking at Roxy's foot. It was now unwrapped. Her foot was dead. There was no blood flow. It was a cold foot. It smelled gangrenous, which means it was becoming infected.
Ugh, that looks bad. If the foot feels cold when compared to the other foot, it is usually a sign that the blood flow has been cut off by either excessive pressure from the bandage or perhaps because of a blood clot in the arteries going towards the lower part of the leg. This will starve the cells in the muscle, skin and nervous tissue from oxygen, which will cause them to die off. And if the wound smells bad or gangrenous and it has this kind of green, yellow, purple discoloration, then it is usually also a sign of a severe infection.
She's gonna lose her foot. And for me, what I wasn't sure of, was this an issue of the bandage being very tight? Or was this more of an issue surgically, that when they removed the tumor, they also took out extra tissue and possibly the blood vessels that go down to her foot?
Again, these types of surgeries can become quite complicated, especially since there are many nerves, arteries and veins running down the leg towards the foot. But if a certified surgeon performed the surgery, then I highly doubt that he would have removed any vital structures. If the tumor was locally invasive, meaning it got tangled around some of the blood vessels and nerves, then yes, it may have been necessary to remove them as well. But then in this case, the surgeon would have known whether or not the lower part of the leg will still have enough blood supply from the other arteries that are still intact, and if not, he would probably have called Dr. Mike to discuss alternative options, which unfortunately usually include doing a full amputation of the leg.
They basically said, yeah, look, we think we should amputate.
Yeah, so a necrotic leg in which the cells already died off is unfortunately beyond saving. So the next best thing is to amputate the leg high enough away from the source of infection, because if you don't, the infection and bacteria will go into the bloodstream, causing a septicemia, which could make your dog very sick and eventually kill her.
If I was working with a human surgeon, I think that we would have thought about those risks, that if we open up or are potentially getting ready to open up a person's body, and then we see that we can cause more damage than actually benefit by doing a biopsy or removing a tumor, we actually don't do it.
This kind of circles back to the importance of making an informed decision. You as the pet owner is in your full right to know all of the risks and benefits involved with any type of procedure, and it is therefore extremely important to sit down with your vet to discuss everything in detail beforehand. At the end of the day, you are ultimately responsible for making decisions on behalf of your pet, so make sure that you completely understand and are comfortable with your decision, and ask as many questions as you feel you need to.
Now we're saying we have to amputate her entire leg, and not just the entire leg, the scapula as well, because apparently in dogs this is the way to do it.
So the reason why we would typically remove the scapula as well, which is the flat part of the bone connecting the leg to the thorax, is that because dogs carry the most of their body weight, about 60%, in their front legs. So by removing the scapula, we are taking a little bit extra load off from the other leg, which now need to support the weight of both legs.
Kind of told me some new information that I didn't know about dogs, that they tend to handle amputations better than humans because they don't have the psychological traumatic component of this, where they don't miss having the fourth leg.
This is very true, and sometimes quite difficult for pet owners to understand. We as humans are actively conscious about our appearance and how we are perceived in public. But dogs do not have this psychological way of thinking as we do, and therefore missing a limb, an eye, an ear, or even all of their teeth is not really that big of a deal for them, as long as they can still function well with their other legs and senses and can therefore continue to maintain a good quality of life. Taking off a leg to prevent future chronic pain and discomfort and potential other complications is often the best thing that you can do to help your dog.
And because of that, they seem to rebound quite well. And I will say, out of this whole process, that's probably been the most accurate part of it, that Roxy has recovered quite well, thank God.
Now, I've seen many patients, especially the younger dogs, start running and jumping up and down after only 1 day post-surgery. Dogs and cats have a much higher pain tolerance than we as humans do, and therefore they tend to recover from major surgeries like amputations much faster than what we would.
She's happy, obviously slightly lower energy because she fatigues. And now I know she has higher risks of getting arthritis in her legs because she's unbalanced. She has to put more stress on each one of the joints.
Yes, so because her left front leg now has to bear double the weight and that she kind of needs to adjust the position of her foot to balance properly, this does put extra strain on her carpal, elbow and shoulder joints, which may aggravate the development of arthritis. Now, another thing that we also often recommend before taking off a leg, like during an amputation, is to take x-rays of the joints of the other leg to see if and to what extent arthritis is already present. Now, Huskies as a breed are already prone to developing osteoarthritis, especially later in life. So if the left front leg is already compromised, then a prosthetic leg on the right might actually be a good idea to help take away some of the weight burden from that left front leg. Now, Roxy might also need to go on a special diet to help support her joints, and if she starts to struggle, she might also need some anti-inflammatories and analgesics to help with the pain and discomfort caused by the arthritis.
So all in all, this goes to say, you know, when you bring your dog to the vet, make sure you're armed with good information. Make sure you ask hard questions of both not only the general vet, but the surgeon. Make sure they give you accurate risk assessments, because it's very easy to say, oh, we'll just take this out, easy peasy, no problem. But then like your dog can lose a limb and it could be quite frustrating because it feels like you didn't get all the information. But know that pets are sadly not immortal, and you want to think about their quality of life just as importantly as you do the length of their life.
Dr. Mike mentions a very important concept here. You need to think about your pet's quality of life just as you would do the length of their life. Now, in an ideal world, we would like our pets to become just as old as we do. But because they have much shorter lifespans, they simply won't. And when they reach the end stages of their life, we need to kind of ask ourselves if they are actually living a good quality of life, especially when big decisions like invasive surgery need to be made.
And I'm really glad that, you know, this terrible situation kind of had not the worst ending.
Now, I can fully understand Dr. Mike's frustration with the situation, and you can clearly see that he is upset with the outcome of what had happened to Roxy. Now, I'm really glad that he shared his experience by making this video, as it highlights the importance of being equipped with the right information so that pet owners can make informed decisions. But I do also want to point out something that I strongly feel you all should understand. We as veterinarians need to wear many different types of hats. Unlike human medicine, where you will be referred to many different specialists, your vet will likely be the only professional that treats your dog all the way to the end, especially if you live in a rural area or if your funds are limited. To give you an example, if this dog walked into our clinic with a lump on his front right paw, I would need to be a clinical pathologist to try and diagnose the growth under a microscope, a radiologist in order to take and interpret the x-rays and ultrasounds to look for any signs of potential metastases, an internist in order to perform and interpret blood tests to determine the dog's suitability for surgery, an anesthesiologist in order to work out a suitable anesthetic protocol, a surgeon to remove the tumor, And if the dog were to receive chemotherapy, some GP vets will also need to be an oncologist. On top of all of this, your vet will also likely need to be some sort of counselor to help talk you through this difficult decision that will not only impact your dog, but also you and your entire family. And as you can imagine, all of these fields are already quite complicated on their own. So throwing them all together and mixing it up between multiple types of species that your vet is expected to treat, I hope that you can understand that it is impossible for your vet to never ever make a mistake. We are only humans, just like you. So please, ask questions, educate yourself. Make sure that you are comfortable with every single decision that you make on behalf of your pets, but at the same time, be kind and respectful to your vet. We are not in this industry for the money. We are here because we genuinely want to help your animals.